Good afternoon, everyone. Welcome to Tranquil Tuesdays and a special welcome to our special guest today. This is Dr. Kirstie Griffiths. She is a chiropractor, a yoga instructor, and today I'm so delighted to have you. Welcome.
Thank you so much for having me. I love being here to chat with you.
I'm so excited because, as you know, but as people watching may not know, is that we work together at Norfolk Wellness in Guelph. And through our time working together, one of the things that I have loved about ever since you joined the practice there is your approach and this mind-body approach, because it is so in alignment with how I practice. And I think that this is a side of certainly of chiropractors that a lot of people don't get to see that often, because not everyone practices the way you do. And I think when we get into mind-body medicine, it's kind of a field that when we start talking about it, and I talk about it so much that I don't always realize that everybody might not know what we're talking about when
Yeah,
we say mind-body medicine. And
yeah.
so I wonder if we could take a step back and let me know, like, how did this become how you practice? How did you find mind body medicine rather than maybe more traditional chiropractic or, other ways of looking at health?
Okay, we're launching right into it. I
Yeah.
actually have a personal story that really led me on this path. I guess starting out with the actual term itself for our viewers who might not be familiar with the term mind-body medicine, we're talking about the connection between mental and physical health. So a lot of the time people view chiropractors as focusing almost exclusively or predominantly on physical health. We're talking about the joints and the muscles and the bones and all of those other connective tissues. So for me, the reason that I started practicing the way I did, actually the reason I went to school to be a chiropractor stemmed from an experience that I had that was very much reflective of this mind-body model. So when I was in university, I was going through a very stressful time in my life. There was a lot going on emotionally. I had just had a falling out with some of my childhood friends at that time, and there were some things that had happened in my childhood, some trauma that had not been processed that was sort of showing up for me at that point in my life. I didn't know that though. So what I knew was that I got to this stage, it was the summer in between my second and third year, and I started getting these recurrent infections. So I was getting UTI after UTI. I was going to a walk-in clinic, being given a prescription for antibiotics, and then within days of the prescription ending, getting another infection, going back to the walk-in clinic. And this was such a frustrating process because first of all, my family doctor wasn't in the area. So the actual efficiency of there wasn't a way to make an appointment. So I was waiting a long time to get into the doctor. And each time I knew what was happening again, but you have to go through that whole process, right? So there's a lot of time being missed from work, and that was just amplifying the stress that I was feeling to begin with. And I think one of the things that was frustrating for that, about that for me, was in talking to the doctors, I wanted to understand why this was happening. Like, I was going to school, I was studying biomedical science, I was thinking at that point I might want to be a medical doctor, and I was very curious as to why this was happening. And every person that I spoke to did not really have an answer for that. The history was very brief. They would ask the screening questions to diagnose that it was a UTI. So those things that we know, the frequency of urination, burning, pain, that kind of thing. But they weren't really asking anything beyond physically what I was experiencing. And what was more frustrating was the advice that I was being given was, oh, you just need to be more hygienic. That's how you solve this problem. So I did that for 3 months of this back and forth, and I was working actually at a naturopathic clinic that summer volunteering, and I mentioned this to the naturopath, and she said, well, book an appointment with me and we'll figure out what's going on. And that was the first time. It was probably about an hour that it took for us to go through the history together. That was the first time I had ever had a doctor ask me questions about what's going on in your life right now. How have you been feeling emotionally? And that question was this, the floodgates just opened up, and I started talking about a lot of the things that I was processing at that time, and she was asking me more questions, and I felt very safe and very supported in that environment. And after that initial visit, it was a referral to a counselor. That was the treatment that I was prescribed, not an antibiotic. And I had one session with a counselor, and I did not have another UTI after that. And that, honestly, at that point was quite pivotal for me. And I still wasn't sure what profession I wanted to go into. I was still thinking possibly going into medicine or naturopathy. But at that point, I knew that this model of mind-body medicine and really addressing some of those other factors was what I wanted to do and how I wanted to practice healthcare.
Yeah. Thank you so much for sharing that part of your story with us today. I think it highlights that this part of mind-body medicine and this idea that we aren't separate, that our mind and body, you know, got separated in the Enlightenment, and that was not particularly enlightened of us, because they influence each other, and that gets hidden. And once you experience that for your own life, or, you know, if you're a science-driven person and you read up on the field of psychoneuroimmunology and you get into like, oh, right, this is not just some woo-woo thing. This is real. This is scientific. This is happening in the body. You forget that there's a whole philosophy and our whole culture is actually built on the philosophy that these things are separate. And it's actually quite radical still to integrate those into our life and our health. And it is outside of, I won't say conventional medicine, because I don't think that's true. It's in all medical professions. There are different practitioners that have put these together, are working to put these together, and everywhere is on their own philosophy with that, and their own journey of learning, you know, how much our mind is impacting our physical body on a day-to-day.
Absolutely. Yeah, I think I don't blame the people who I had that experience with. I think now that I'm also working as a healthcare provider, I can appreciate how you get really used to seeing one particular thing, and it's easy to kind of get these blinders that develop where you know what you're looking for, and if you're sort of confirming what you're looking for and what's showing up, you can forget sometimes about the other parts that may be playing a role in people's health. So I know, especially for chiropractors, because we are so focused on the physical component, that yeah, it's easy to kind of forget about that other realm. And also because there are parts of that are outside of our scope. So it's also knowing when it would be appropriate to refer to another healthcare provider who can help to manage some of those pieces.
Yeah.
But I do think there's certainly value in being able to screen for that. And I think a lot of that can happen just in the conversation that we're having with patients, right? That's what it was for me. It was just having somebody ask the right questions beyond, you know, the 3 things we need to confirm a diagnosis, but what else is happening in that person's life, and what's going on with that person that's sitting in front of us.
Yeah, I love that. And I think that is part of what attracts people to mind-body practitioners, to holistic and functional medicine, whether that's chiropractic, whether that's naturopathic, is that experience of being listened to, being seen, of taking more time to get into the root causes. And, you know, I don't know how we get more of that happening, because it's so important to the healing experience to feel seen and feel heard. And I'm hesitant to say that it's always that people always need more time, because I have seen fabulous medical doctors, fabulous nurse practitioners that were able to make me feel seen and heard about small issues in short amounts of time. So this isn't a conventional or alternative or complementary conversation. Yes. It's how do we find a way to create space
Mm-hmm.
so that people can share and ask those right questions so that people can share what's really going on.
Yes, absolutely.
I know that you take longer than other chiropractic than some other chiropractic doctors in your initial visit, but I also know that I think it's shorter than my initial visits. How do you cultivate that space and build that rapport quickly?
Yeah, so my initial visit, I mean, again, I also try to avoid calling it out in time blocks, because I've had, that appointment is 45 minutes, but I've had times where I feel like we get through the history and physical exam more than sufficiently in half an hour. And
Yeah.
I've had other times where I've had to press pause on the appointment after about 50 minutes, knowing I was running late for my next visit, and having that person come back for a second 45-minute visit to continue with what we were doing.
Yeah.
So I do think it's important to recognize that different people are going to be different. And there truly are, like, I have patients who come in and it's not a complicated case. It's really, I sprained my ankle yesterday. This is what happened. And that's pretty much all that goes into it. But I think recognizing that it can be a different conversation. And when people have other health conditions they've been diagnosed with, or other experiences that they want to talk about with other healthcare providers, or they've been dealing with this pain for a long time, that's one area of my practice when people have been experiencing chronic pain where this comes up quite a lot. That is probably going to warrant a deeper conversation and allowing the time and space for people to talk through some of those things. And I find, yeah, even if you prompt people with the questions, they want to talk about what they've experienced, and that, I think, is part of the healing. I've had experiences where patients, because I don't usually treat on the first visit. That is something as well that's part of my model that's a little different from some of the other chiropractors that I work with locally in Guelph. I often will have that first visit that is just for intake, and part of that is also, it's a trust building process. So that's part of how I help to facilitate that safe space, is that we're not even doing hands-on care in that first visit. We're establishing rapport, and I'm getting to know you. At the same time, you're getting to know me to figure out if I'm the right practitioner for you. And then on the second visit, it's another 45 minutes of primarily discussion. So at that point, we're going through the report of findings, and we're talking about what is the diagnosis we've come up with in here, and how do we manage that? And on top of what do we do in the clinic, it's also what can you be doing when you're not in here that might help. And I often include, mind-body practices. We'll talk about diaphragmatic breathing or meditation or referrals to other healthcare providers. So it really ends up being almost a 90-minute process of getting to know one another before we even start with the hands-on treatment. And I think that is part of what helps to develop that safety. By that point, people feel comfortable with me for the most part to be able to talk about some of those deeper things.
Yeah. Yeah. So definitely having that time and asking the questions, like literally inviting people to share that part of their life with you.
Yeah, absolutely.
Yeah.
I think because chiropractors, we do a lot of hands-on work. And kind of when we were talking about getting into a routine when you're familiar with what you're doing, and sometimes you lose sight of those other pieces. So I know as a chiropractor, sometimes we're used to placing our hands on people. We do it all day long. I think when you do that enough, you forget sometimes that this is a really different experience for people, and it's a very personal experience, having that physical touch. If you're dealing with anyone who has had trauma in the past, or has some anxiety or depression or other mental health things going on, that the physical touch can be a sensitive thing as well. So I just try to be sensitive of that and aware of that as we're going through those first couple of visits, especially to make people more comfortable who are a little hesitant or apprehensive about what chiropractic is.
I love that about you.
Thank you.
It's not a good question. It's not good conversation. It's just true.
Thanks.
It's just true. Let's talk a little bit about the mind body practices that you sometimes prescribe. You're talking a little bit about diaphragmatic breathing, or talking about doing some kind of meditation.
Mhm.
How is that like? How is that a mind body practice? What does that mean? Where do we dive in to start connecting? Um, I'm answering my question as I'm thinking. Our brain and our body, our mental experience, and our physical self.
That's a really good question. So I'm also a yoga teacher, and I have a special program that I run. It's yoga for back pain. And it was really designed to connect these two pieces. And in that program, one of the things I talk about is what distinguishes yoga from stretching or other forms of exercise is the breath work and the intention. So a lot of it is being very mindful. We're cultivating this mindfulness practice, which basically means drawing awareness to the present moment and really paying attention to the experience as it is right now. A lot of the time we are living either in the future, thinking about things that we need to do later today, we need to do the groceries and what's going on at work later this week. Or alternatively, we're living in the past where we're reliving things that have already happened, especially I find with the pandemic and everything that's happening right now, maybe reflecting on how things were different or better 6 months ago. But we spend a lot of time with our minds either going forward or backward, and not a lot of time being really focused on this moment right here, which is really the one that counts. So these mindfulness practices are practiced when we're doing breath work, when we're paying attention to what is the sensation of the breath moving in and out of the body, and how does it feel to fill up those lungs, and all these things that are so automated. I mean, we breathe all day long and we don't usually think about it, but we're calling some awareness to it. And to me, I think that really is the difference between maybe other forms of exercise and yoga itself is we're slowing the breath down for starters, which is a really lovely way to shift the nervous system into safety and a feeling of rest. But we're also really paying attention. And when you're dealing with pain conditions, which a lot of my patients, that's what they're trying to manage, you learn a lot in those moments of being present. You can start to establish what are the triggers, what are the things I'm doing that I may not have even noticed before are actually making things feel worse. And at the same time, what are the things that feel really good for my body that I might be able to use as a tool to come back to in moments where I'm feeling that pain? Because the more control people feel like they have over their pain, they tend to have a better recovery that way. So that's kind of the start of that mindfulness and awareness practice, and how it's starting to connect what's going on up here with what we're physically experiencing in the body.
Yeah. Thank you for explaining that. I think it can sound complicated, and it can also be really simple. And even just thinking about that awareness of like, what's happening in my body?
Mm-hmm.
And posing that question, and what makes it feel better and what makes it feel worse. It's not, I think a lot of people jump from mindfulness into like meditation practices that you have to be a monk and, sit for an hour in the morning and an hour at night minimum. And it's like, well, that's actually one way to
Yes.
engage. And if that's your way, that's great.
Yes.
But also, you can bring those principles into a lot more accessible forms. And that's something that I definitely talk about in my practice a lot when we get into mindfulness and meditation, is understanding where it's already happening in your life. Maybe if there's a hobby that, maybe you're a knitter and that's a way that brings you into the present moment, or maybe you really like watering your lawn and that's just like very peaceful for you. And like, how can we get more of that type experience, however you're currently accessing it?
Absolutely. Yeah, I think that's really important. Like understanding that getting into that state does not have to be you sitting in stillness for half an hour. And in fact, that's not the first thing I recommend to people, because I think it's a very advanced practice, something I'm still working on. I find I physically start to get uncomfortable after a short period of time, and it starts to distract the process. So that's not where I start people. Yeah, some of the other suggestions, like what you were mentioning about gardening or knitting, those are two amazing examples. Another one that I'll start people with, and that I started trying to implement in my own life a couple years ago, was being really focused on the one task that I'm doing rather than trying to do everything, but doing, 5 things with 20% effort. So for example, the classic example I use is when you're watching a movie, how many of us keep our phones nearby and are simultaneously scrolling through Instagram or texting? And to me, I end up missing parts of the movie, but I'm also half engaged in the conversations I'm having on the phone. So just trying to be mindful of, if I'm sitting down to watch a movie, that's what I'm doing. I'm going to be really present with that activity that I'm doing, and I'm going to do this thing after. But that's just one example of how we can start to sort out the different pieces and just be available for what we're doing right now.
Totally, totally. And I think cell phones are a great example of that because they have become so prevalent, so invasive. They are a complete attention disruptor. And they, if anything, have highlighted the need for a mindfulness practice, even just to counteract the cell phone. Like, even if there's no other stressors in your life and you're pretty good at like attention and focus, if you have a cell phone, you probably need to balance that out with a mindfulness practice.
Yes, totally.
It is, yeah, a modern problem and quite an ancient solution.
Yes. Yes.
Yeah. So I know that you've shared a little bit about that yoga for back pain program and some of the ways that you bring mindfulness into your practice as a chiropractor. If people listening are interested in learning more from you, getting in touch and learning more about, your approach, or just hanging out in your community, how can they do that?
So I have actually recently been trying to up-level my social media stuff. So you can find me in a few different places. On Instagram, I'm the Chiropractic Yogi if you're looking for me. The other place you can find a lot of my information is on my website. So that's www.yogachiropractor.com. That has all the information and portals to the yoga programs that I'm running. There's actually one that's coming up in September. Since we've been given the go-ahead for phase 3 here in Ontario, gyms are starting to reopen a little bit. So we're looking at running that program again in person starting in September. So if you're local and you're looking for a yoga program, especially if you do have back pain and you're looking for sort of a stepping stone that'll get you back into your drop-in classes at the gym or studio, that's a good place to find that. So you can find that all on my website.
Amazing. Oh, I'm happy to hear that yoga for back pain is coming back in person, because I know that that has been a successful program for, some of my patients that I've referred to that have been happy with it. So that's good to hear that it's coming back.
Yeah, I'm excited to have it come back with some changes and some new things. But
good. Well, that's the great thing about programs, right? Like yours, they're always evolving, becoming better, and I'm sure the changes will be, as a result of the experience that you've had running this program.
Yeah, absolutely. And there's actually on that topic, because there is an online variation of that as well that I launched in June. I actually have a demo video that's available for people if they're wanting to try it to see what the cueing and what the sequencing would be like. So maybe we can include a link for people for that as well if they're interested in trying it out.
For sure. Yeah, we can absolutely put a link to that below this video. So if you are interested in just checking out a little yoga demo,
yeah,
do that and get yourself a little bit moving, a little more mindful, and cultivating that mind-body practice, any way that you can.
Absolutely.
All right. Well, thank you so much for joining us. If anybody has any questions for Dr. Griffiths, just leave them below. Tag her, tag me, and we'll see if we can get any of your mind-body health questions answered over the next couple of days.
Love it. Thank you so much for having me.
Thank you for taking the time. It's always a joy to chat with you. And thank you for sharing so much about your approach and your story, and really just taking that first layer off, like what even is mind-body medicine? Because I think that conversation was well overdue in this group. So I appreciate your help unpacking that.
My pleasure.
All right, you have a great day.
You too.
Bye.